Hey, future RN. So glad you're back for part 2 on heart failure. Today, we are going to tackle everything you absolutely have to know for the 2026 NCLEX. We're talking interventions, meds, patient teaching, and those scary complications. Ready? Let's jump right in. Welcome to ClearPath NCLEX. We're all about giving you that high-yield content you need to pass on your very first try. And hey, if you find this helpful, do me a quick favor and hit that like and subscribe button. That way you won't miss out on any of our game-changing NCLEX tips. Okay, so here's our action plan for today. First, we're hitting priority interventions. Then, the must-know medications. After that, we'll cover essential patient teaching, how to recognize scary complications, and we'll wrap it all up with a quick-fire quiz. And listen, mastering this stuff, it's not just about passing the NCLEX. It's about being a safe, confident nurse for your future patients. All right, let's kick things off with Section 1, Priority Nursing Interventions. When you think of a patient with worsening heart failure, I want you to picture someone with heavy fluid. That's the key. Our job as nurses is to know exactly what to do first when they are literally drowning in all that excess fluid. Okay, here's a super helpful mnemonic to lock this in. HOPE. H is for head of bed up. We're talking high Fowler's position, maybe even leaning them over a bedside table, anything to help them breathe easier. O is for oxygen, as ordered, of course. P is for push diuretics, think furosemide. We need to get that fluid off and fast. And E is for end sodium and fluids. That means we're putting them on a fluid restriction and looking at any non-essential IVs. Now, let's talk about something that is so important, both in the real world and for the NCLEX daily weights. You have to remember, in heart failure, weight gain equals water gain. It's that simple. So your patient teaching is crucial. They need to weigh themselves every single day, same time, same scale, wearing similar clothes. And here's the magic number you need to remember. A gain of more than 3 pounds in a single day or 5 pounds in a week is a huge red flag. They need to call their provider right away. Okay, let's move on to the next big topic, must-know medications. Seriously, these are the heavy hitters for heart failure, and you're going to see them all over the NCLEX. It's not enough to know what they do. You absolutely have to know the potential harm they can cause, too. So here's a really quick look at the main classes. First up, diuretics. A lot of them end in "ide." Their job, drain that fluid. The big watch out, potassium levels. Then you have your ACE inhibitors and ARBs. You know, the prils and sartans. They lower blood pressure, but watch out for high potassium and that annoying ACE cough. Next are beta blockers, the LULs. They slow the heart rate and lower blood pressure, which means you have to check those vitals before you give it. Every time. And then there's digoxin. It gives the heart a stronger squeeze, a deeper contraction. But, and this is a big but, it has a huge risk for toxicity. Okay, let's zoom in on a classic NCLEX trap, because they love to test this. It's all about potassium and diuretics. You've got 2 main types. First, the potassium-wasting ones, like furosemide. These make you lose potassium, so you'll teach your patients to eat K+ rich foods like bananas, potatoes, and leafy greens. But then you have the potassium-sparing kind, like spironolactone. This one makes you hold on to potassium. So the teaching is the complete opposite. You tell them to avoid those high potassium foods. If you can nail this difference, you've totally outsmarted a classic NCLEX question. All right, let's talk about the one med that seems to scare every nursing student, digoxin. I want you to burn this phrase into your brain. Digoxin is the toxin. Yes, it helps the heart pump stronger, which is great. But the problem is that the line between a helpful dose and a toxic dose is razor thin. We're talking a therapeutic range of just 0.5 to 2.0. That is tiny, which means the risk for toxicity is always there. So you absolutely 100% have to know the signs of digoxin toxicity. The first clues are usually in the gut, nausea, vomiting, maybe they just don't feel like eating. But then you get the really classic signs, the ones the NCLEX loves, vision changes, things like seeing fuzzy yellow halos around lights. And here is the most critical connection you need to make. Low potassium levels, hypokalemia, make a patient way more likely to become toxic on digoxin. Remember that. Okay, so we've covered what we do for the patient. Now let's talk about what we teach the patient. This section on patient teaching is so important because really all the meds and interventions in the world don't matter if the patient goes home and doesn't know how to take care of themselves. Our teaching is what prevents those readmissions and empowers them to be in control. So here are your top high-yield teaching points. Number 1, and yes, I'm saying it again because it's that important. Weigh yourself every single day and report any gain over 2 to 3 pounds. Number 2, take your medications exactly as prescribed, no skipping doses. 3, this is a huge one, avoid certain over-the-counter meds, especially NSAIDs like ibuprofen and many cold medicines. They are full of sodium and can make heart failure worse. 4, know your body and report worsening symptoms, like more shortness of breath or new swelling. And finally, number 5, stick to that low-sodium, fluid-restricted diet. Let's make the diet part super simple. On the safe side, you've got fresh, unprocessed foods. Think grilled chicken, fresh fruits, steamed veggies. Easy, right? Now, the danger zone, this is where all the hidden sodium lives. We're talking canned soups, salty snacks like chips, and deli meats. Just drill this into their heads. Sodium swells. If they can remember that, they're on the right track. Okay, now we have to talk about what happens when things take a turn for the worse. This section is all about recognizing complications. These are the absolute life-threatening red flags that you, as the nurse, have to be able to spot in an instant. Seriously, if there is one thing you remember from this whole explainer, let it be this: pink, frothy, sputum. If your patient starts coughing this up, that is the #1 classic hallmark sign of severe pulmonary edema. This isn't a wait-and-see situation. It is a full-blown medical emergency, and that patient needs help right now. So, to recap, our top 3 life-threatening complications are: #1, pulmonary edema with that pink, frothy sputum; #2, cardiogenic shock, which is when the pump just completely fails; and #3, digoxin toxicity, which we've talked about and can absolutely be fatal. You have to be on high alert for all 3. Woo! Okay, that was a ton of information, I know. So let's do a quick fire quiz to help lock it all into your brain. You ready to test your knowledge? Let's do it. Okay, question number 1. Your client is on digoxin, and they tell you they're feeling nauseous and seeing yellow halos around the lights. What is your priority action as the nurse? Think about it. Your absolute priority is to hold that next dose of digoxin and call the provider immediately. Those are textbook signs of toxicity, and you have to act fast. All right, next up, which statement by a patient would make you think, okay, my teaching about the low-sodium diet actually worked? The winning statement would be something that shows they get the fresh versus processed rule. So if they say something like, instead of my usual can of soup for lunch, I'm going to have some baked chicken and a side of fresh vegetables, yes, that's what we want to hear. Okay, last one. Your patient with heart failure has gained 4 pounds since yesterday morning. What is the very first thing you're going to do? Remember your nursing process. The first step is always to assess. Before you call anyone, before you give a med, you need to grab your stethoscope and listen to their lung sounds. You're listening for crackles, a sign that fluid is backing up into their lungs. Assessment first, always. And you made it through. See? Heart failure is a beast of a topic, but when you break it down into these key pieces, it's totally manageable. You're doing an amazing job. Just keep studying. You've absolutely got this. Hey, thanks so much for sticking with me through part 2. Before you go, I've got a question for you. Which one of these heart failure meds scares you the most? I have a feeling a lot of you are going to say digoxin. Drop a comment below and let me know. I read every single one. And if this helped you out, please give it a like, subscribe for more, and I will see you in the next one.